Hi everyone, welcome to Leonard's Oasis. Today I'm going to discuss about the eclampsia. I have already posted the pre-eclampsia. You can subscribe my channel and watch it before going to eclampsia because as you know, eclampsia is a severe complication of pre-eclampsia. So most of the symptoms are the same but in a severe form plus convulsion. So it is essential to know what is preeclampsia. Then you go to learn about eclampsia. Eclampsia. Preeclampsia when complicated with grand mal seizures, that is generalized tonic-clonic conversions, and coma is called eclampsia. Preeclampsia जब complicate हो जाती है when there is brain pathology, uh, patient starts to convulse or patient develops convulsions, grand mal seizures. So, and patient may go into unconscious or coma state. So, this condition is called eclampsia. Thus, it may occur in patients with preeclampsia or in patients who have preeclampsia superimposed on essential hypertension or chronic nephritis. सो प्री एक्लाम्शिया जब कॉम्प्लिकेट होकर पेशेंट को कन्वर्शंस होने लगता है, जनरलाइज सीशर्स होने लगता है और पेशेंट अनकॉन्शियस हो जाती है, इस कंडीशन को एक्लाम्शिया कहते हैं. ये सारे प्री एक्लाम्टिक पेशेंट को कॉम्प्लिकेशन हो सकता है. सारे all types of pre-eclampsia can develop into eclampsia if it is not treated properly. Now, causes of convulsion. What causes this convulsion in the patient? The cause of cerebral irritation leading to convulsion is not clear. The irritation may be provoked by anoxia, cerebral edema, and cerebral dysarrhythmia. So exact cause किसी को नहीं पता convulsion होने की क्या वजह है, लेकिन इसको कुछ assumptions है, जैसे कि anoxia, brain में anoxia हो गया, ऑक्सीजन लेवल्स कम हो गया तो cerebral vessels में spasm आ जाती है, cerebrovascular resistance ज़्यादा हो जाती है and there is a fall in cerebral oxygen consumption. So जो brain में जो oxygen मिल रहा है उसका consumption कम हो जाती है और patient को anoxia हो जाती है. Then cerebral edema. Cerebral edema है तो again anoxia को हो जाती है, इससे that may lead to irritation. Then cerebral dysarrhythmia increases following anoxia or edema. There is excessive release of excitatory neurotransmitters like glutamate. So cerebral dysarrhythmia भी हो सकता है. ये दोनों anoxia और cerebral edema की वजह से और excitatory neurotransmitters produce हो जाते हैं. ज़्यादा एक्साइटेटरी न्यूरोट्रांसमीटर होने की वजह से पेशेंट कन्वर्शन डेवलप हो सकता है. ये सारे assumptions हैं. Now we'll see the clinical features of eclampsia. Eclamptic convulsions or fit develops. The fits are epileptiform and consist of 4 stages. फिट्स जो है epilepsy जैसे फिट्स आती है पेशेंट को, इसको 4 stages में आती है convulsions. इसको eclampsia का stages भी कहते हैं. First stage है premonitory stage. The patient become unconscious. यहाँ patient unconscious हो जाती है, muscle twitching होती है face, tongue और limbs में, eyeballs roll करके एक side में चले जाता है और fix रहता है eyeballs. The stage lasts for 30 seconds. ये stage जो है 30 seconds तक रहता है. Next stage है tonic stage. The whole body goes into a tonic spasm. पूरा body जो है एक spasmic state में आ जाता है, tonic spasms हो जाते हैं पूरे body में. Limbs are flexed. इसका जो limbs है वो flex रहेगा, hands clench करके रखेंगे. Then respiration जो है stop हो जाती है, tongue बाहर आ जाती है, दांतों को बीच में से protrude होकर बाहर आ जाती है. पेशेंट को साइनोसिस होगा क्योंकि यहाँ पे रेस्पिरेशन स्टॉप हो रखी है. आई बॉल्स बिकम फिक्स्ड. आई बॉल्स पहले से फिक्स द फर्स्ट स्टेज से, देन द स्टेज लास्ट फॉर 30 सेकेंड. ये स्टेज भी 30 सेकेंड्स की है. Next stage है clonic stage. All the voluntary muscles undergo alternate contraction and relaxation. पहले टॉनिक स्टेज में स्पासम था, पूरा बॉडी स्पास्मिक स्टेट में था. अभी वो बॉडी मसल्स जो है शेक करने लगा या उसको कंट्रैक्शंस एंड रिलैक्सेशन होने लगते हैं. एज अ रिजल्ट देयर इज shaking movements of the body. The teaching start in the face, then involve one side of the extremities, and ultimately the whole body is involved in the conversion. So जो पहले से टीचिंग हो रखी थी फेस में, वो जो है एक साइड में स्प्रेड हो जाती है, दूसरे साइड में आ जाती है, और पूरे बॉडी में कन्वर्शन होने लगता है. बाइटिंग ऑफ द टंग होकर यहाँ पे पेशेंट टंग बाइटिंग कर सकते हैं, क्योंकि टंग ऑलरेडी प्रोट्रूड हो रखा था पिछले स्टेज से. Then breathing is stertorous and blood-stained. Through these secretions, fill the mouth. Patient का mouth से blood-stained through these secretions आने लगता है, झाग जैसे secretions आने लगता है patient का mouth से. Cyanosis यहाँ पे disappear होने लगता है, क्योंकि muscles हिलने लगा है. Patient start to breathe now. This stage lasts for 1 to 4 minutes. ये स्टेज जो है थोड़ा लंबा रहेगा, 1 से 4 मिनट तक रह सकता है ये. Then next stage है stage of coma. Following fit the patient pass on to the stage of coma. Patient coma में चले जाता है जो ये stage में. It may last for a brief period or another deep coma persist till another conversion. कुछ पेशेंट्स में थोड़ी देर के लिए पेशेंट कोमा में चला जाता है, फिर कॉन्शियस हो जाता है. लेकिन कुछ केसेस जो वर्स्ट केसेस है, वो कोमा से पेशेंट बाहर नहीं आता है, उसके वो जैसे कोमा एंड होता है दूसरा कन्वर्शन का एपिसोड शुरू हो जाती है. ये भी हो सकता है. On a question, the patient appears to be in a confused state following the fit and fails to remember the happenings. Rarely the coma occurs without prior कन्वर्शंस. तो कुछ केसेस में पेशेंट जो कंफ्यूज हो जाती है, उसको कुछ याद नहीं रहेगा क्या हो रहा है या क्या हुआ, कुछ याद नहीं रहेगा. कभी कभी बिना कन्वर्शन का भी पेशेंट कोमा स्टेट में जा सकता है. सो ये 4 स्टेजेस हो गया पेशेंट का कन्वर्शंस के. क्लिनिकल फीचर्स विल कंटिन्यू विद इट. The fits are usually multiple, recurring at varying intervals. कई बार एक दिन में कई बार फिट्स आ सकते हैं, और varying intervals में फिट्स बार बार आते रहेंगे. When it occurs in thick succession, it is called status epilepticus. एक कन्वर्शन खत्म हो गया, थोड़ी देर में दूसरे शुरू हो जाती है. ऐसे कंटिन्यूसली जब कन्वर्शंस आने लगते हैं, उसको कहते हैं स्टेटस epilepticus. Following the conversions, temperature usually rise, pulse and respiration rates increase, so the blood pressure also. So conversion के बाद temperature, pulse, respiration वगैरह जो vital signs है, वो सारे बढ़ जाते हैं. The urinary output is markedly diminished, proteinuria is pronounced, and the blood uric acid is raised. सो यूरिन आउटपुट कम हो जाती है कन्वर्शन के बाद. प्रोटीनूरिया होने की चांसेस थे पेशेंट को, होने की चांस नहीं, प्रोटीनूरिया से ज्यादा हो जाती है पहले जितने था. प्रोटीनूरिया से स्पेसिफिक फीचर इन प्री-एक्लैम्प्सिया एंड एक्लैम्प्सिया, द यूरिक एसिड लेवल्स भी बढ़ जाती है. You'll see the signs and symptoms of eclampsia. Hyperpyrexia, that is fever, there will be fever. Cardiac complications include acute left ventricular failure, cardiomyopathy, renal failure. Hepatic complications include necrosis, subscapular hematoma, cerebral edema, hemorrhage, neurological deficits. And pulmonary complications include edema due to leaky blood capillaries, pneumonia due to aspiration, hypostatic or infective adult respiratory distress syndrome, embolism. These are the signs and symptoms. Signs and symptoms will continue. Another complications are injuries, tongue bite, injuries due to fall from bed, bed sore, then shock, hematological complications like thrombocytopenia, disseminated intravascular coagulopathy, postpartum complications like disturbed vision, the fetal complications. Perinatal mortality is very high to the extent of about 30 to 50%. The causes include prematurity, spontaneous or induced, intrauterine asphyxia due to placental insufficiency, retroplacental hemorrhage and spasm of uteroplacental vasculature, effects of the drug used to control convulsions, trauma during operative delivery. These are the causes of perinatal mortality. Management. The patient has to be admitted in the hospital. The principles of management are maintain airway breathing and circulation, hemodynamic stabilization, that is control, BP, oxygen admission 8 to 10 liter per minute, oxygen, organize investigations, arrest convulsions, deliver by 6 to 8 hours, ventilatory support if needed, prevention of complications, prevention of injury, postpartum care. If ICU is needed, give care in the ICU. We will continue with the management. Supportive care include to prevent serious maternal injury from fall, prevent aspiration, to maintain airway and to ensure oxygenation. Detailed history is to be taken from the relatives relevant to the diagnosis of eclampsia. Then duration of pregnancy, number of fits and nature of medication administered outside. We will continue with the management. Examination of the mother, but thorough but quick general abdominal and vaginal examination should be done. Monitoring half-hourly pulse, respiratory rate, and blood pressure are recorded. Then hourly urine output is to be noted. If undelivered, uterus should be palpated at regular intervals to detect the progress of labor, and the fetal heart rate is to be monitored. Antibiotics should be given to prevent infection. Immediate measures during convulsion. During convulsion, what has to be done? Call for extra help to put patient in left lateral recumbent position. Maintain oral airway. Oxygen inhalation. Non-breather mask 10 liters per minute. Commence IV lines 1 or 2 wide bore cannulas should be put. Foley's catheter should be inserted and intake output chart should be maintained. Monitor oxygen saturation. Pulse oximeter should be there. SpO2 should be maintained more than 95%. Control of seizures is done by magnesium sulphate IV or IM regimes. We will continue with the immediate care to monitor vitals, fetal status, and magnesium toxicity. Control hypertension by giving labetalol, hydrolysine. Fluids should be given crystalloids or colloids less than or equal to 125 ml per hour should be given. Suction, both oropharyngeal suction should be done. Diuretics in case of pulmonary edema to prevent it. investigations to organize blood, CBC, AST, ALT, LDH, creatinine, uric acid, urine analysis for protein. All these investigations should be done. Magnesium sulfate is the drug of choice for eclampsia. So the regimes, there are two major regimes followed in the hospital. We will see. One is intravascular and one is intravenous. For intravascular regime, the loading dose is given IV 4 gram of 20% solution IV over 3 to 5 minutes followed by 10 gram 50% solution deep IM 5 gram in each buttocks. Then maintenance dose of 5 gram 50% solution IM 4 hourly in alternate buttocks. Then intravenous regime, loading dose of 4 to 6 gram IV, slow over 15 to 20 minutes, maintenance dose of 1 to 2 gram IV infusion. Then other regimes for eclampsia include lytic cocktail using chlorpromazine, promethazine and pethidine, diazepam and phenytoin. So these are the other regimes. If magnesium sulfate cannot be used for the patient. Treatment is continued. Antihypertensives and diuretics. In spite of anticonvulsant regime, if the blood pressure remains more than 160 by 110 mm Hg, antihypertensives should be administered. Then treatment of complication, prophylactic use of antibiotics reduces complications like pulmonary and puerperal infection. Pulmonary edema is another major complication. Furosemide 40 mg IV followed by 20 gram of mannitol IV reduces pulmonary edema and also prevents adult respiratory distress syndrome. Now the management during fits or during convulsions. In the premonitory stage, a mouth gag is placed in between the teeth to prevent tongue bite and should be removed after the chronic phase is over. So tongue bite can occur. To prevent the tongue bite, a mouth gag is placed between the teeth. The air passage is to be cleared of the mucus with the mucus sucker. There will be frothy mucus. It should be sucked out from the or by oropharyngeal suction. The patient's head is to be turned to one side and the pillow is taken off. Pillow has to be taken off. पिल्लो हटा के पेशेंट का हेड जो है एक साइड में करके रखनी है. Raising the foot end of the bed facilitates postural drainage of the upper respiratory tract. Foot end of the bed थोड़ा ऊंचा करके रखना है ताकि इससे postural drainage हो जाएगा upper respiratory tract से. Oxygen is given until cyanosis disappears. Cyanosis खत्म होने तक ऑक्सीजन देना है पेशेंट को. Status eclampticus can be there for some patients. So in that case, thiopentone, sodium 0.5 gram dissolved in 20 ml of 5% dextrose is given intravenously very slowly. The procedure should be supervised by an expert anesthetist. If the procedure fails, use complete anesthesia, muscle relaxant and assisted ventilation by may be employed. Intubation is done if patient remains unconscious in post-seizure period. May be due to aspiration. Seizures not, if the seizures are not controlled, intubation is done for the patient. If in unresponsive cases, cesarean section in ideal surroundings may be life-saving attempt. Management of complications will continue. Heart failure is another complication. Oxygen inhalation, parental Lasix and digitalis should be given. Then anuria, another complication. Dopamine infusion 1 microgram per kg is given with oliguria when CVP is above 8 mm of Hg. Hyperpyrexia, it is difficult to bring down the temperature as it is central in origin. However, cold sponging and antipyretics may be tried. Psychosis, chlorpromazine and esgazine, trifluoperazine is quite effective for psychosis. Intensive care monitoring, multidisciplinary approach, intensive care unit should be given to the patient. The obstetric management of eclamptic patient. The patients with the fits controlled, baby, if the baby is mature, delivery should be done. If the cervix is favorable and there is no contraindication of vaginal delivery, surgical induction by low rupture of membrane is done. Oxytocin drip may be added if needed. When the cervix is unfavorable, cervical ripening with the PGE2 gel and pessary should be achieved before ARM. If the cervix is unfavorable and there is obstetric contraindication of vaginal delivery, cesarean section is done. We'll continue with the obstetric management. If the baby is premature, that is less than 37 weeks, delivery is recommended in a setup with the neonatal intensive care unit, that is NICU. The underlying disease process of preeclampsia and eclampsia persists until the woman delivers. At times, the disease process may flare up, may go. Moreover, there lies the risk of recurrent convulsions and IUFD. Steroid therapy is given when pregnancy is less than 34 weeks. Up to now we were talking about the woman with the fits controlled. Now, if the fits are not controlled, with anticonvulsant within a reasonable period 6 to 8 hours, termination of pregnancy should be done. अगर fix control नहीं हो रहा तो उसका termination तुरंत करनी है. If vaginal examination indicates a quick response to induction, low rupture of membrane is done, oxytocin infusion may be added. The uterus responds well to oxytocin in such cases. Then, in presence of unfavorable factors, cesarean section gives a quick response. Indications for cesarean section: uncontrolled fits in spite of therapy. Indication cesarean section कब करनी है पेशेंट का? Uncontrolled fits है मेडिसिन देने के बाद भी, unconscious patient and poor prospect of vaginal delivery. Then obstetric indications like malpresentation or any other complications. These cases, cesarean section should be done. Thank you for watching. If you have any doubts, you can contact me and clarify the doubts.